Hi there, everybody. I'm here with my good friends, Dan Richards and Dave Moore, who are two business leaders in the Cleveland community, good friends of mine. And I often get into really interesting conversations with both of them, individually and separately, around just the nature of what I do and medicine and all of what's going on in the world around this pandemic, as well as what we can do as individual human beings. And I thought, wouldn't it be great if other people could participate in these conversations? And so we decided to kind of set up a little bit of a segue of going over some of these important topics and some questions that these guys have posed to me before. So today we're going to talk about a bit of the history of medicine and just different medical philosophies. So I don't know if either one of you want to say anything about yourselves or who you are. Maybe I should also just add that Dave is a friend of my husband's, and then we met a couple years ago, and he had me come and speak to his forum with an organization called Entrepreneurs Organization, which I quickly also joined. These guys are in the big leagues. I'm in the little leagues of that organization. And I came and spoke to Dave's forum group, which is, maybe you can explain, Dave or Dan, what a forum group is, and we can go from there, and maybe you have some questions.
We do. Dave and I have a relationship because we're both business owners. We meet once a month, and he's like one of my board members, and I'm like one of his board members. And there's a group of 9 other guys we get together for the past 5 or 6 years just doing that. And through that, we bring in experts like Erin. And to be honest with you, I had never really considered an alternative to dealing with my health issues. And for the last it's been about 25 years. I've suffered significantly from autoimmune diseases, and I have a whole cadre of bone specialists and joint specialists and therapists and rheumatologists and my general practitioner, just managing my symptoms. And here I am. I'm alive, so I'm very grateful for their practice and their thoughts. However, just managing my symptoms didn't seem to be the type of life I was looking for. And then, as I get older, managing the symptoms comes with some downsides. Some of the medicines I take to manage the symptoms was reducing my immune function, which would cause me to get sick when I get on the airplane, and have my colds would last much longer for me than for other people in my family. And, I was missing work, things like that. So somewhat skeptically, I started visiting with Erin. And Erin's approach has been totally different than what I was used to. And since August 7th, I've been off of my $1,500 a week injections, which was controlling my symptoms. So I've been on a little bit of a journey with Erin. And since then, I've been really investigated and I'm trying to learn more and more and more. And I appreciate you, Erin, even having me on this call, because I'm super interested in this movement, if you will, if it is even a movement. But, I'm a walking example of a skeptical person who is suffering and has gotten some benefit out of a brain shift on how to approach my illness.
Wow, Dan, that's really interesting to hear. I never knew you were a skeptic. You never presented yourself as such. I mean, I kind of see it maybe a little bit more now, but you always seemed very logical and open enough to try something different, which, I just want to add, I'm really glad that you did, because the medicine that you were on is one that we know causes cancer. And yeah, I felt like when I first met you, like, wow, this man really needs some other approaches to help him head off, a train wreck that he may not even be aware is what's about to happen. So thank you.
You're welcome.
I think that's really interesting. And, I've always been sort of a curious person. And when I started to talk to Erin, I was always, in the back of my mind, I was always like, gosh, why are we always like treating the symptoms? I think, Dan, when you said, yeah, they were taking care of my symptoms, it's like, it's almost like parenting in a way. Do I want to just punish them for that one thing, or do I want to explain kind of the bigger purpose around why I want that behavior to change, and kind of looking at those parallels? But I don't know. I'd love to hear you talk a little more about that idea of, just trying to deal with the symptoms, or maybe looking at it in a broader perspective.
Yeah, I think it's really important. I mean, that goes right to the heart of the core of how I think when I'm seeing someone in my office that pertains to what I would call therapeutic philosophy. And I think this is something people don't really think about anymore. And we don't realize that medicine in and of itself is like the oldest science that was ever practiced. You know, the minute that you had two organisms, one trying to help the other one out, you were practicing medicine. So like, where does that even begin and what does it even mean? And we have gotten so into the weeds on trying to understand the parts by breaking it down into pieces and just dealing with suppression of symptoms without really remembering that symptoms are messages. They have purpose and they have meaning, and they are created by an inherent process in the whole being that has just been so completely lost in the current system of medicine that's predicated upon more of a dualistic nature of reality, that there's mind and there's body and there's matter, and matter is what is determining all this. So this kind of machination that has been made out of the human being is where we get lost, because you've got to recognize that symptoms have a purpose. If you forget that, you're just going to suppress them and not think about the past or the future and what any of it means, as long as you don't have any symptoms, without realizing that you're then creating the chronic problems as a result of how you dealt with the initial symptoms, which are typically and generally what we call acute symptoms. Those are things that come on, used to come on quickly and violently, and, were the things that people used to die of back before we had all these tools to kind of suppress some of those acute illnesses and diseases that are known to kill people. But
Erin, I remember when we first started working together, I would just shake my head because I'd get off the phone with you because you were so delighted that I was suffering, and I wasn't suffering in a terrible way, but oh, that's good news, Dan. It's moved to your gut. That means that you're healing and this is going to happen. And typically my reaction with all my doctors is, hey, I'm suffering. How much do I got to pay you to get me to stop suffering? And you were more interested in my suffering as a part of the journey.
Well, the reality of it is, and I say reality somewhat specifically because I think this goes back to this whole history of medicine thing too, is like, we think that reality is just the parts and the pieces, but we got to understand there's this whole other component that comes out of experience. So one of the most interesting things I think we have to realize is that when we look at a history of medicine, a true history of medicine that goes all the way back and incorporates holistic philosophies and the, more rationalist, logical type of philosophies, reductionist philosophies, that you really have to take into consideration that it's the experience of the practitioner and the experience of the patient that has still guided everything all along the way. Like, you may find something in a scientific study, but if it doesn't bear out in experience, you're still going to have to throw that out. It's not going to work, or it needs to be reevaluated. And I believe that that's part of why we're so stuck in our current era, because we've put all of our eggs in the evidence-based medicine basket. And what does evidence-based mean? People want to talk about it as if it's, well, there's no research on this, there's no double-blind trials on this, but we have to come back to a place of, there's value in both sides of the picture. There's value in the scientific research, which frankly, we use very, very, naturopathic medicine is a Western tradition, and it is a blend of both of that holistic and that reductionist approach, but definitely has more of that vitalistic, holistic core to it, kind of always coming back around to the experience has to inform the theory, the experience of the physician, the experience of the practice. What do we see over time? What do we learn over the decades? What do we learn from our forebearers and our mentors? Could you imagine your profession without a mentorship, without having had a mentor? It's the same in medicine, and we have to really start to value and honor that we can't just throw out anecdotes and we can't just throw out experience and stories. And it's all so relevant because we are not just the parts, we are not just the pieces. And now, we're also up against this problem of not being able to know in our current, dominant medical model, we don't know how to incorporate the findings of some of the latest and greatest science, which is, goes down to quantum physics and the concept of the Heisenberg uncertainty principle, which means that if you observe a phenomenon, you actually have an impact on it when it's under observation versus when it's not. And that's going to impact our physical bodies and beings as well. So it's really more about consciousness than it is about just, medicine. So sorry, that was a lot, but ask me some more questions.
Erin, you mentioned the double-blind study. Can you elaborate on that a little bit more?
Yeah. One of the things that I think is really fascinating that I know 99% of people are not aware of is back in the 70s, I think it was, there's a medical writer, a medical historian who, his name is Harris Coulter. Unfortunately, he's passed away at this point. He wrote some of the most amazing books about the history of medicine. And I, tell anyone who has any interest in this to check out this 4-volume tome called Divided Legacy. But he also wrote a little tidy book called The Controlled Clinical Trial. And it's a really fascinating review on the concept of the double-blind trial and how it happened when they had the group of researchers and physicians come together to try to create the structure of how they were going to do research. And it's all predicated on this concept of homogeneity, that you can have a group of people that are homogeneous, that are similar enough that you start off with this group and then you have your control. And it's flawed at the outset, you see, because this concept of homogeneity within a group of human beings is a very difficult thing to actually define. And what happened in these meetings is they essentially said, well, there's no solution for this, so we're just going to ignore it and we're going to proceed anyway. And what you've come to find out is that you will get some things in double-blind trials that have helped us propel the needle forward, move the progress in medicine, and yet it's also a very limited approach, and it's also an approach that does not have within its very design the capability of studying more holistic paradigms in medicine, which go, all the way back to the origins of humankind and before, which can't just be tossed out because they don't fit this, pretty scientific technocratic model of what medicine is. I mean, you and me and most people are coming to the point that the conventional approach, and I really want to clarify that is convention, not traditional medicine. People say traditional medicine meaning Western allopathic conventional medicine. Traditional medicine is really all that has gone back all the way to the beginning of time, and all of that empirical, experiential, observational data that has come with it through theoretical practice, philosophies of medicine. That is very different than convention as it's practiced, but I digress. So we have to be able to look at, there are other ways of knowing beyond just a clinically controlled trial and a current research model. Now, there's lots of different ways of developing information. I mean, we have meta reviews and we have people, combing the research, looking more for patterns now. That's more of the kind of thing we have to open ourselves up to, and not just say, oh, well, there was one study against this, or there's no evidence. And it's becoming lesser and lesser, I've noticed, over the course of the last 20 years since I've started practicing naturopathic medicine, that you would oftentimes get a physician to say, well, there's no research on that about, a particular natural substance. And I hear it less and less. You still hear it. And then okay, well, this doctor is not paying attention and they're not doing their homework, because anybody, you, me, anybody who's got access to Google can go on PubMed and can search, vitamin C, they can search, N-acetylcysteine, they can search, herbs, they can search all different kinds of substances that come out of nature and start to put these relationships together and see that there is a whole hell of a lot of research that no one can deny. And now we just need a more holistic viewpoint and paradigm and inclusive approach to be able to help the people who are dying.
I believe in the history of my illnesses, my medicines from, what did you call it? It's not traditional medicine. It's
Conventional.
conventional medicine. The medicines have gotten better. And, I used to suffer a lot more, and the medicines I would take would make me suffer in a different way and reduce certain things. But over time, everything has gotten better. So I have feet in both camps. However, the COVID experience it's very frequent for me. I'm very interested in this. I'm an autoimmune risk. So I need to know a lot about this disease. And it's very easy on the same day to see a double-blind study done by somebody that comes out with the conclusion A, and then very shortly after that, you get the same study or same idea of looking at an issue, and they come out with the complete opposite.
Yeah.
And they are using the traditional methods. And then it's super frustrating, and it gets lots of press, meaning it's headline grabbing. So whose ever channel it is, whatever they want to promote, they will jump in and run with something that's very misleading.
Right.
And then I stumbled across things from the 1918 pandemic. And you see that there were doctors back then painstakingly documenting their experience with patients. And one that really caught my eye was in these sanitariums where they had these patients that really couldn't leave the sanitariums back then, how they were treating those patients. And then they compared it to the general public. They compared it to army bases and a whole bunch of other groups. And the sanitarium patients were dying at like 2%, and the rest of the population was dying at like 17%. And they were telling everybody exactly what they were doing that was different. And they were the only ones doing it. And it was the hydrotherapy. And I'm sure you understand this more than I do, but getting in a hot water bath for a period of time, followed by cold water after that, seems to do something to your immune system. And this guy had documented all of this information. But because it wasn't formatted in the digestible way that everybody wants now, the double-blind format, you never saw a headline about it. But yet we all got tubs and we all got showers, and we all could have been leveraging something in such an easy way that it's frustrating. I think there's hundreds and hundreds of years of experience that you have with stuff that has worked.
Right.
But because it didn't been tested since the 1950s, so there's no double blind, it just goes to zero, and you got until there's money to test it. And by the way, Erin, how much do those studies cost? There's no such thing as a $1 million study. I mean, it's expensive, and who's paying? The guy who's paying is hoping to make 100 million, I would guess. Right? No one's paying that type of money.
Thank you, Dan. Thank you so much. See, we are so much more aligned than you ever admitted. I mean, look.
You call it conventional medicine. I'll use that language. Conventional medicine, eventually I became dissatisfied with, and it was mostly because I never felt heard, and the system was the system, and it was just frustrating. If I didn't have the right question, and then I walk out of the doctor, it was just, you lost your opportunity. So I moved to functional medicine, and I've been very satisfied with the amount of time that they take trying to understand at a deeper level what's going on in my body. And, how I ended up with you is even the functional medicine guys, I wasn't getting results that I was hoping. I was getting listened to. I was getting much more thoroughness of care.
Yeah.
But it seems like when you get to holistic medicine, it's, for my journey, it was kind of a last resort episode.
Unfortunately, yeah.
Can you comment a little bit on, I'm not really in a rush to dump my functional medicine doc, and I'm definitely, my relationship with you in holistic medicine has opened my eyes to a lot of things. How do you feel about that, the holistic medicine and the functional medicine, us having two, your advice and my functional medicine advice sometimes are in conflict.
Yeah.
and I value them both. And then in the end, I'm the patient. I have to make my own decision.
Right, right.
But I do, I guess the two comments are, how do you feel about having two different doctors giving a patient a view? And then it seems kind of wrong, I guess. This is more of a comment, less of a question, because I know the answer. It seems wrong that the only time, if it's the case, people end up at holistic is because of frustration with not getting anywhere elsewhere. Like, I should have been with you years ago, meaning without
Well,
that's my
that's part of the politics of medicine and the economics of the dominant medical paradigm. Like, people don't end up coming to us until the last resort because they have to pay out of pocket because there's no institutional systematic support for what we do, which of course would save billions and billions and billions of dollars if people were working on, their lifestyle and their diet and, being educated about what they should do to stop and cease. But that's just not how the system, we're at the apotheosis of that dominant rationalistic paradigm. And
can I interrupt for a second?
yeah,
I mean, your therapies are 1/10 of the cost of the regular doctors. If I was in insurance, I would rather pay for you than the other guys.
thank you.
If you're getting results.
Yeah, right. And that's the whole point, is results for now and the future. Results, not just like, immediate quick fix, which can happen. Like, people think, oh, you have to get worse before you get better. Well, that's only if you're like super severely chronically ill and you've been suppressing and suppressing and suppressing. Yeah, we can't control that the body heals through a process of acute illness and inflammation. That's just how nature works. We don't have any control over that. But back to your piece around functional medicine, because I would like to speak to that a little bit. Definitely, first of all, it's important to recognize that the functional medicine movement is an outgrowth of some holistic minded medical doctors and naturopathic doctors in the Pacific Northwest coming together in the United States. And then there was a parallel tract going on in Germany where the functional medicine movement had a bit more of a kind of a holistic inherent approach to it. Obviously it did here too, because of the naturopaths being more of that holistic paradigm. But there were kind of these two parallel trajectories, and then came, what's happened in the last 30, 40 years in the development of the Institute for Functional Medicine, and a whole massive swath of dissatisfied medical doctors moving into this realm of functional medicine, where they open, private practices or concierge practices. But the way I see it is, they've got a little bit of, they're moving in the right direction, but they're still very much in the dominant medical paradigm of that rationalist mindset of needing the research. They have their functional lab values. They've broadened their horizons, but yet I feel they're really still missing the holistic therapeutic philosophy that takes in the reality of all of nature and cosmology. Even, like, we have got to, recognize there's a place for spirituality in medicine. There's a place for consciousness in medicine. There's a place there. It has to be there. I mean, what are we before we're born, before we are incarnated? And what are we after we leave this, mortal coil? We have to look at that and appreciate that and respect that. And it's not necessarily all just about, life, keeping someone, functioning and breathing on a respirator and a heart lung machine. It's like, at some point we have to bring humanity back into medicine. And that's another piece of the clinical controlled double-blind trial, is that we've really disconnected ourselves from humanity, where, back in the ancient times, and even back before the Industrial Revolution, like, medicine was as much about, the things that, like, what was Florence Nightingale doing? She was a vitalist. She was taking care of her people. She was, it was about love and compassion, and the medicine has to be about that too. And it gets very difficult and very complicated for those of us who are dealing with patients who are very, very sick, and yet still have to manage the psychology of it, because it's all so overwhelming. You have to still come back to a place of what feels right, and what's right for me, and what's right in this moment. And only the patient can decide that. But we don't even get that choice a lot of the time anymore. I mean, I would even say that we're coming to a place of dominant like allopathic tyranny, meaning if you have a child, if either one of your kids were diagnosed with any kind of cancer, if you didn't do what the standard of care says to be done, they would call Child Protective Services on you, and you could have your child taken away from you. How is that not tyranny? It's a saying we are right, we know everything. And when you look at the research of some of these children who have some of these very noxious cancers that are absolutely driven by toxicants in the environment, you will see that their research does not say that they are absolutely going to survive. The statistics do not say that they're going to live. The statistics do not say that they're not going to have a recurrence, all throughout their life. They don't tell you all that. It's just, you have to do it because this is the law, and this is where the power structures come into play. And it's a big mess. It's very difficult to change.
Yeah, the standard of care, it was super interesting. I also have a family history of heart disease and have been on statins since I was a 21-year-old kid. And the statins have been successful lowering the cholesterol. And my doctor said, hey, I think we can do a better job of taking an additional medicine called, I think it's ezetimibe or ezetimibe. You might know the medicine.
That
I
name
don't
doesn't ring a bell.
Anyways, I took an additional piece of medicine and boom, my cholesterol numbers got better. I went to my doctor. I said, what if I just take this and get rid of the statins? Because, there is proven downside of taking the statins. He said, they never really did a study on that pill alone. I'm like, really? Why wouldn't they do that? He said, because you couldn't take someone off the statins, because that would be kind of anti-patient, because that's the standard of care. So they don't even, now I'm taking two medicines because they don't want to get sued by the patient to get me off of a statin to test me on the other medicine. And I'm like, it just is foolish, because I'm pretty sure I could just take the one medicine and be fine. And I really, as I verbalize it, I should just do study of N=1 and take myself off the statin.
Well, I think what you're really speaking to also, Dan, is how doctors today, when you work in any kind of institution, their hands are completely tied. They are not free to be a physician and use the art of medicine anymore, because they have to follow these dictates that are coming from, on high in a platform. And all of that's tied into, bottom line and money generation for whatever the institution is, revenue generation. Dave once, one of the first conversations we had was he had this idea about creating an organization that would pay or benefit the physician based on outcomes and, maybe long-term outcomes. Maybe you can say more about it, Dave, or if anything ever came out of that idea. I thought it was brilliant.
Yeah, I mean, that one is kind of on pause at the moment, but the idea behind it was, let's pay for results, right? And kind of flip it around a little bit and get the patient, the doctor, the support staff, the rehab staff, everybody in alignment for the goal, as opposed to just kind of looking at things in isolation.
So we've talked about so many things at this point, a lot about medical philosophy and, history of medicine and holistic medicine. Maybe we can come back together and talk about immune function and microbes and maybe some other questions that you guys have.